Let it resound.
Loud as the rolling sea.
I like this part right here. Come on.
Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on.
Let us march on.
Till victory is won.
Now we add a little something to it. Just encourage it. We'll take it to church later. Let's go.
We'll keep marching, fighting till the victory is won.
To all my brothers out there.
Hold your head up, brother, till the victory is won.
To all my sisters in the struggle.
Keep believing, sister, till the victory is won.
Till that day.
Till that day comes. Let us march on.
To victory.
Till victory is won. Is won.
Thank you, and welcome to our Black and Empowerment virtual event, where we're able to lift the voices of those who are normally not heard. This week, we'll be discussing Black health, but first, let's hear a few testimonials from some of our employees here at Metro Inclusive Health. Thank you.
My name is Paula Delgado. My pronouns are she, her, and hers, and I'm the peer advocate / health educator at Metro Inclusive Health. I believe I was 26, somewhere around there, and I lived in Clearwater when I got my diagnosis. And I was actually going for birth control and ended up finding out that I had HIV at the clinic. I was shocked and terrified. And my doctor didn't walk me through that diagnosis. My doctor told me to go home and prepare for end of life, which is what they had to tell you. There was no treatment back then, really. I kind of went right into denial really fast. I didn't do anything. I just kept living as though it didn't happen. Not long after, they came out with AZT, and they prescribed me AZT, and I didn't take it. I was just scared to take it. I wasn't sure what they were giving me, and I had a lot of questions. Nobody knew what was going on. HIV and AIDS was really scary back then, and so I just didn't take it. You know, I always remember the Tuskegee experiment, which a lot of people in the Black community remember. And so that was in the back of my mind, wondering, you know, are they just trying to give me something? Are they trying to inject something into me to test something else? And so that was part of it. The other part was the denial. I just figured it was too much for me to grasp, to wrap my head around. So I just figured I'd just pretend it didn't happen. When the new meds came out, I was given those new meds. And I did take a little bit, and then I'd stop, and then I'd take it again. And I kind of played with it. I had a death in my family. I lost my daughter. And I remember focusing on my son, who was 4 at that time. And I remember thinking, I have to be here for him now. And so that was really what started me to becoming adherent. I started reading more about the medications and finding out, asking questions, and started to feel a little more comfortable with doing so. I started to take it, started to feel better. Life kept on going. I was still here, so I kept taking them. And I'm non-detectable now. it was the same deal. In fact, I had conversations with people at work and at home with friends and family. And again, the Tuskegee experiment came up in some of those conversations. And I was afraid too. But then, as we kept talking and I started seeing other people getting the vaccination, I started to weigh it out again and think, Paula, you took a chance on the HIV meds and you're still here and you're fine. So I went ahead and decided to go ahead and take it. But that initial fear of what are they injecting in me? What are they going to do? What is this really about? And then getting to the point of, I'm just going to take the shot. I took my first shot 3 weeks ago, and this Friday I take my second shot. But I do encourage it now. Oh yeah, definitely. I think there's a lack of trust, and it's understandable. All we can do is take that chance or educate yourself and find out as much information as you can, and then you decide whether or not that's what you want to do. I think that the medical field is just going to have more information and more open doors for us to be able to go to get the information. A lot of the people in the Black community don't even know where to go to get the information. Some of them don't have computers. I'm not computer savvy. I need help a lot of times. So just to get that information to read up on, or to, something you can check with the CDC or just people in general, you just have to be able to have that information. So I think if the medical field had more info, maybe flyers or something mailed into the community where they could get that information, I think it might help some. Or maybe people that have already been vaccinated to go into those communities and talk about their experience with vaccination. Anything helps. I would say I understand you, but I would also say take that chance, because this is nothing to play with. I was thinking, I'd rather be alive than to die from COVID. So that's another reason why I took that vaccine. We have to just take a chance sometimes.
Hi, my name is Evan, and I'll be speaking a little bit about my experience seeking out healthcare. So, really, it's just to start at the beginning. It started with me, and this is me speaking on my ignorance of healthcare just in general. It started with me not having not having frequent healthcare visits as a child. Nothing really more than just going to the dentist every now and then, and of course the doctor if I got sick. I never heard my parents talk about the importance of just healthcare in general. We never had that conversation. Doctor's offices, they just seem more like places to fix a problem after it came up, as opposed to somewhere that you would go to maintain your overall health. Now, not to discount my parents, they did have healthcare plans in place, and I would get vaccinated when need be. But there was never really that open dialogue about overall health and healthcare in general. And I think that is what was missing. And not to place any blame, but it really did just that context. That was the start of my ignorance when it came to healthcare, and just making sure I stay healthy overall. Now, just to get a little bit personal, I will say that I grew up with insecurities about my sexuality, me being gay. I'll say it out loud just to kind of show that I've grown a little bit. But that caused me in the past to just really actively not seek out care. I wouldn't do anything more than just getting the regular HIV test. In the past, HIV was just something that I feared, number one. Which is another form of ignorance, and it is something that I definitely feared the most when it came to just my overall health. So I would get infrequent tests, just tested it here and there, every now and then. Once I, maybe just got scared that I could have contracted the virus, or just when I felt like it might have been that time. But it was definitely nothing that was frequent. And it was not always a full STD panel, and it was certainly never a primary care visit. again, I definitely did have an aversion. I just did not feel comfortable going to a doctor and just a stranger essentially, but a healthcare provider who I didn't know and just kind of divulging all of my business. And not to say that it was a very interesting business, but just me being very insecure about my sexuality really kind of created that very real barrier to care and not to I mean, and just to kind of compound all of that, what was going on, I didn't even have health care at that time. So that could be one of the biggest hurdles when it comes to getting health care. And that was my experience at that time. Now, to fast forward a little bit, once I got a little older and I actually gained access to health insurance, in the first few years of me having it, I really didn't utilize it as I should. Just the fear and the ignorance that I brought with me from my young adulthood, it kind of kept me from looking after myself. And unfortunately, it took me getting to my late 20s and experiencing both of my parents go through medical procedures. Fortunately, both of them are fine now. But they going through that and seeing both of my parents kind of be vulnerable in that sense, it did something to me as it would most feeling people. But my dad's experience, I think, for the purposes of my story, it kind of touched me the most because it started with my uncle giving him a call. It just when my dad got to a certain age, my uncle called him and just kind of told him that he should just get checked up for certain things. I'll spare all of the details just for the fact it's family business, but um, so yeah, just my uncle called him and he ended up going to get checked up. My father did. So the doctors did find something that they checked for. But the good thing about the story is that they actually found they actually found what it was early. And my dad was able to have a non-invasive surgery. And like I said earlier, he also is okay. And that really did open my eyes to start taking precaution for my own health. It wasn't a position that I wanted to be in later in life. If I was fortunate enough to make it to that age, I didn't want to be in that position to where I could be dealing with something that I maybe could have prevented with just just general checkups, just frequent quarterly, if not just twice a year checkups. So just to kind of bring this whole story home, I did realize that my own ignorance was my main barrier to care in the past, and I did work on fixing that. I did really educate myself on the fact that, and when it comes to getting care, like employers do help you. They have help to go through all of the plans. They're at least able to help you find the one that would fit your specific needs. And there are either even healthcare hotlines, even if you don't get healthcare through an employer, that it's people that are paid to help you kind of navigate the whole process. Because I mean, no matter who you are, whether you're at the top of the healthcare service or just a patient, it can be confusing and you're not going to know everything. So there is always that help that is provided, and that's something that I had to teach myself. And just when it comes to the healthcare provider that I have now, it did take some time. I don't want to paint the rosiest picture, like I just jumped in and everything was cool. I did kind of have some of that trepidation still going into it, and I think it takes more of that, just really the repetition and those frequent visits, whether you're going in for annual visits or just sexual health checkups. When you are able to have those frequent visits and open up about certain things, and at least this is what's helping me to my experience, it makes it a lot easier to be more honest. And of course, if you're more honest in the healthcare environment, especially your provider, they're going to be able to have all of the information that they need to make sure that they are taking care of you the best way that they know how to. Well, I do hope that my story at least helps somebody to be able to just be a little bit more comfortable going into a healthcare center, or at least just kind of start that internal dialogue that's needed to take that first step into the office. So with that being said, I definitely do appreciate the time, and yeah.
That was very nice. I'm so grateful to work with such amazing people who make themselves so vulnerable in telling their stories. This is the Carol Winfrey Show today, and we'll be exploring the Black health, and we want to do some amazing things. So please sit back and enjoy all of our events that we have for you tonight. Let's enjoy our skits. Thank you. Selena, oh my gosh, today has been such a busy day. How you been?
I'm good. A little tired, but I'm good.
Have you seen Evan?
I don't know. You're supposed to be here already.
I don't know where Evan is. Up to Evan, where's Evan? There you are, finally.
Oh, I'm sorry, y'all. I was just reading this article. You know, the healthcare services in this country is crazy. Have either of y'all heard of Henrietta Lacks?
No, I haven't.
Who's that?
Well, ultimately, she was a Black woman whose cells were the first to be successfully multiplied in a lab in the 1950s. Her cells were used to discover vaccines for polio and HPV, treatments for salmonella, HIV, and cancer. Her cells were used for toxicity research, AIDS research, even gene mapping.
Wow, that's amazing. All that medical advancement from that body of a Black woman?
Yeah, but the doctors replicated her cells without her or her family's permission.
What?
Yeah, some of the labs were for-profit labs too, benefiting financially from the body of a Black woman.
That's just terrible. What did the family say when they found out?
You mean when they found out 20 years later? Yeah, Henrietta died before her cells were multiplied, and her family only found out when doctors reached out to them for blood samples. They were attempting to use her family's blood and potentially their cells to continue research using their DNA.
That story is crazy.
All right. It reminds me of the Tuskegee experiment, one of the more known experiments that's in our history that's caused us a lot of trauma. You know, that very experiment was overseen by our own government, which infected over 400 Black men with syphilis and intentionally left them untreated, all because they was curious to know what would happen to their Black bodies.
Man, I have to keep taking notes on this. I didn't know about that. This is crazy. I got to keep hearing.
Yeah, it is crazy. And those are just a couple of examples of why Black people still have mistrust in the healthcare system. I also recently learned about this old surgeon back in the 1800s named Marion Sims. His history lauded him as like the father of modern gynecology, developing tools used on women still today. And he was said to have pioneered procedures that help women to survive after childbirth.
Wow, that sounds great. But wait, you said this was the 1800s?
Yeah, he used enslaved Black women as his own guinea pigs.
What?
Yeah, right. And he made all of these advancements in gynecology only because he had many different Black women who were enslaved to work on. None of them, of course, with their permission. And it's easy to imagine that none of them were handled with care. You know, he had no regard for their lives. So simply use them as live props with no regard. And it's no wonder that Black people came through the 1900s, basically fearing hospitals, not trusting medical professionals. We've been through a lot in this country, and it's nothing that we can't get over without actively combating those stigmas. You know, it's sad, but you can really draw a straight line from those past injustices to what's going on today.
You know what? It's ironic that you asked that, because you was researching something. And I'm thinking about it was Black history, and it's also women's health. I was actually looking up Serena Williams. Did y'all know Serena Williams during her pregnancy, she almost died?
What? I didn't hear about that.
Yeah, she almost died. I actually had pulled something on her, and Evan came with this, and I was pulling up a story about her and her first baby. She had her first baby, and she almost died having her first baby. And it was telling me, due to her history, she already had a history of pulmonary embolism.
Oh my God.
That's unbelievable.
And guess what? During her time when she was getting ready to have give birth to the baby, how about she started feeling some kind of way? You know what I'm saying? She had already had an episode before, so she knew how her body was feeling, y'all.
Mhm.
And guess what? Her mom was in the room with her. And she tipped out. She started feeling funny, so she tipped out of the room to tell the nurse, y'all need to check me, because she knew how that body was feeling.
Right.
And they didn't actually really check her, and she started gasping for air and everything like that. When they did take her back, she told them, I need a CT scan. She knew
had
how
to
her
tell
body
them
was
that.
feeling. She told them. She told them.
So you mean as a celebrity, Serena Williams and her mother had to advocate with let's be real, with the income that she has, and they still didn't take her seriously, and she almost had a poor birth outcome?
Exactly. First baby at that. And they didn't even want to hear her. Then when they went to do it their way, they started checking, and it was like, guess what? Now we got to go to a CT scan. When they went in, they seen that she had several blood clots going on. And then they gave her what she needed. Ain't that something?
Wow.
She could have died. She could have
That
died.
says anybody can actually go through this. And if Serena, who's famous, can get this done.
Everybody knows her. You would think that the providers would want to take special care. So people at the bottom have no chance.
It's crazy. I mean, even it was also telling me how Black women are more likely to face these complications. The same thing she faced is Black women are more likely to face these complications more than a white woman is during childbirth. So it's 3 to 4 times higher. And
3 to 4 times.
3 to 4 times, right?
That's crazy.
And you know what? I also was checking out. I was also checking out the doctor. You remember Dr. Y'all know Dr. Susan Moore? You know, the Black doctor?
I think I heard about her. What is
Yeah,
she?
it sounds familiar.
The Black doctor that passed away due to COVID complications.
I heard about
But
that.
wasn't she in the hospital though?
She was in one hospital. And she was telling them what she needed, a CT scan. Okay, they was not listening to her. They thought the lady was on drugs. She's a doctor.
Wow.
Listen, they thought she was on drugs. They wouldn't even treat her. They weren't even listening to her, what she was going through. And what they did was they actually just let her sit there for a while. And guess what? She finally had to contact the chief medical officer. And, you know, they gave her a little help. She actually got her CT scan. They found out she had different things going on all in her neck. And then they gave her the medicine. She moved to another hospital. They sent her home, y'all. When they sent her home, before she moved to another hospital, they sent her home. They sent her home, and she wasn't even home long, and she started getting fever up to 103. Went back to the hospital, and by the time she got back to the hospital, a little while later after that, guess what? This lady passed away. She knew what she had, but because they did not treat her,
They didn't listen.
and it was a white doctor, and I had to say that it's a white doctor, and it's sad to say that, but that doctor did not treat her fairly, and she lost her life. And that's something,
Unfortunate.
you know, and that's happening today. But you know what? I just want to tell y'all my story.
Tell me,
y'all know my
Selena.
story.
I need some good news to tell me.
Well, I'm going to tell
Yeah.
you about today. Today is awesome because I actually, in 2018, working here, I was diagnosed with stage 2 triple negative breast cancer. And the thing is, let me tell y'all this. As I was working here, I was at work one day, and I actually felt this little pain. And one thing I want to say that my doctor was not Black. My doctor was a white doctor. I had a white doctor. And my doctor, because my doctor cared about my well-being and my health, made sure I had the proper care and caught this quickly.
That's awesome.
That's right. I mean, wow, I'm living today because of listening to my body, for one, as a Black woman today. A lot of times, like these young ladies here, they listen to their bodies. Their bodies told them, guess what? This is wrong with me. This is going on. I listened to my body. When I felt something, I told my doctor and we went forth. And today I am cancer-free, y'all.
Yes,
I'm cancer-free. I went through the storm in the rain. My hair came out, fingernails turned black. I had chemotherapy sitting in a chair. But with one thing that helped me, positivity. Being around positive people and just having a positive attitude and knowing that I was going to make it through this and knowing that I was choosing the right proper care. Okay.
You took it into your own account.
I took my own
accountability.
Yeah, exactly.
Gotcha.
One thing about us, what we can do is we have the authority to say, guess what? If we don't feel the doctor is doing us the right justice, we can choose another doctor because it is our bodies.
Mm-hmm.
And one thing I did to assure that my healing was going to be great is I did what they did. I listened to my body, and I acted on it.
Awesome.
So I am, you know what? And I'm gonna say, guess what? We got some doctors. We got some doctors. Let's see what our doctors have to say about.
Exactly. I think we got some doctors coming up going to give us some more information, but that was powerful.
I know. I'm here to tell the story.
Now, how you doing? Welcome back to the Carla Winfrey Show. I'm so pleased to be here on today. That was a truly amazing skit. Thank you so much from Tiffany Gray, Selena, and Evan Clark. I really, really, really do want to give a shout out to them. Listen, if you are out there and you want to chime in on our conversations, please feel free to comment in the chat. Please make your comments. We will be talking to our medical professionals about some difficult conversations. Please feel free to join in with us. This is about you. This is about Black health. This is about everything that our community needs, okay? So thank you so much. I want to take a moment to introduce our panelists and also to mention our sponsors. Truly, thank you so much for your sponsorship and your dedication to allowing us to have this event on today. We truly do appreciate it from the bottom of our hearts. Our first provider that's going to be on our panel tonight is Cynthia Sleppy. Cynthia came to Metro in December of 2017 with experience in hepatology and involvement with healthcare in over 28 years. So please show Cynthia lots of love. Clap, 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 clap. Also, we have Dr. Thomas Taylor, board certified dermatologist. Dr. Taylor is an American Academy of Dermatology board certified dermatologist. He is a member of the American Society of Dermatology Surgery, the Bay Area Medical Association, and the Florida Society of Dermatology Surgeons. Thank you so much. We also have Vanessa Mishkit, a retired BSN, former clinical director. Vanessa D. Rowland Mishkit is the former clinical director of the Central Hillsborough Healthy Start Project, a project of Reach Up Incorporated. Thank you so much for joining us, Vanessa. And we also have Darius Lacey, Public Health Service Manager, who is unable to be with us today. We want to thank him for his efforts and wanting to be a part, but he had a family emergency, so we do thank you for wanting to be with us on today. So I want to go ahead and get right into things. Do we have all of our providers available? I see you, Vanessa. How are you?
Hi.
Hey, Cynthia. How's it going? And also, do we have Dr. Taylor? How's it going, ladies?
Oh, well, thank you.
Absolutely.
Good evening.
You okay, Cynthia? How's it going?
I'm doing well. Nice to be here. Thank you for the invitation.
Absolutely. We'll go ahead and we'll get started, and hopefully Dr. Taylor will pop in and be able to grace us with his presence. I have a few questions, ladies. I want to go ahead and get started. Why do you think the Black community is disproportionately affected on multiple health outcomes, such as birth outcomes, high blood pressure, HIV and COVID, etc.?
That is an excellent question. And I have to say that it's been well established that disparities and adverse outcomes in the Black community persist. I've been in this community since 1986, and I have been working ever since. And we know that the fundamental causes of these racial disparities lie in the social environment. And the individual's life trajectories can be modified if effective communities initiate interventions and policy change actions in a timely and sustained manner. that doesn't absolve us from our personal responsibility. Like I think one of the other young ladies, I believe it was Selena, that was talking, and she was saying how she advocated for herself after she found out that her health was not up to par. And to this day, because she listened to her body, advocated for herself, and listened to wise counsel, she is absolutely cancer free. Now, we also know that the most efficient and effective way to alter these health trajectories of families in the socially disadvantaged communities like I worked in the East Tampa area in the initially the federal Healthy Start program. So we took care of pregnant women and children. We also maintained a DADS program right from the very beginning in the early to late 90s, late 90s when we started the federal program. So we know that with these socially disadvantaged communities, in order for things to work, we have to work in close and integrated coordination with the collaborative network of organizations that can instill the change in multiple social determinants of health. People talk about these poor and they don't pull their weight, and there's always something that it is the person's fault why they're not doing well. But that's not true. It has a lot to do with the social determinants of health. What we're doing as far as the early childhood development, I grew up and worked in New York for a time when the Head Start program started way back when. And you guys may be too young for this, but that came out of a lot of the civil rights. And yes, people talk about Black Panthers, but I was back there. And it was because of the push that many of them did that the Head Start programs started with underserved kids in the Black community. And then what typically happens is that when it's starting to work and changes are being made, then it's kind of ripped from us. Then it was the Montefiore and programs, and then a lot of Black kids weren't able to get into those programs. But that's a story of a different different time. So I don't want to go down that avenue. What I want to talk about is here in Hillsborough County and the lack of early childhood development. We have early Head Start. Many Black people aren't taking advantage of that. Family resilience, no matter what happens in our communities and in our families, there's a resilience there. We won't go away. The social support, we don't have a lot of social support. A lot of our men are incarcerated. There's a huge disparity in that as well. The healthcare access, Evan talked about how his parents didn't really say much about overall health and being healthy. However, they talked about what they knew, which was not anything. And I'm not being negative about the parents, but the lack of knowledge and the lack of education in our community, we didn't have anywhere to go. And we didn't have people who looked like us to even go and say, okay, I'm going to go to this Black doctor over here because they'll know where I'm coming from. The housing situation, another social determinant of health, where when I first moved to Tampa, and I'm talking a lot about my experience because I've been in this arena. I've been a nurse for over 40 years here in Tampa for about 30, my youngest middle kid is 33. So when we first came to Tampa, there were projects, Ponce de Leon and College Hill over there on 22nd Street. Well, they revitalized all of that. They revitalized other areas. And then the people that they moved out didn't meet the criteria to be able to get that housing. So then they just moved to another area. If you happen to have been incarcerated, unless you're going to come out and start your own business, you're not going to get health care. And I talk a lot because I'm passionate about this.
Oh, I love it. Thank you. I love it. Keep going.
So, we keep going around and around these circles and not making headway, yet still people look at us and say, look at them. Here they go again. They're not making the headway, but we don't have the systems in place to help us make the better decisions. We see every single day how our men, we just had the losses with blacks and the gentleman George Floyd. I'm at the age now where my mind kind of blanks a little bit. So George Floyd, that gentleman is just coming up to trial, the one that murdered him.
Sure.
And all the rave is, oh, look at the Black Lives Matter. Well, don't Blue Lives Matter? Don't these lives matter? We have been kicked to the back burner since we've been in this country, and we have remained in the back burner. Has there been positive changes? Yes, absolutely. But the progress has been extremely poor. That's why I was excited about being asked to join this webinar here, because we need more of this type of thing so that we as a nation can be empowered to make the right decisions, but we don't have trusted advisors that can lead us in the direction that we need to go.
Absolutely.
So long and short of that is, yes, we have a lot of barriers that prevent us from having even just the bare minimum. And to me, bare minimum is adequate health care. But we also need equity in health care, because we're not getting the care that we need on a consistent and sustained basis.
Very nice. Very great point. Thank you so much. I want to take a moment just to snap a few times, because you said a bunch of great things in what you were saying, and I really do appreciate you for all of what you said. Yes, social determinants do play a huge part, as well as the education, as well as the equity that we need to overcome. I also want to bring up too the language in what we need to kind of educate ourselves on how to speak and advocate and articulate what's happening with our bodies.
Yes.
As a young person, I remember all I know was my stomach hurt. I didn't even know what nervous or anxious meant. It just meant my stomach hurt to me. So imagine being in a medical setting and having an actual pain. You don't know how to really articulate what's happening with your body. So I completely agree with you on that. I do want to take a moment, Cynthia, if you want to add to, you definitely can. But Darius has just joined us. Thank you so much for taking a moment to be with us, Darius. We really do appreciate it. We are now talking about why do we think that Black communities are disproportionately impacted by different health disparities. So we want to go ahead and allow Cynthia a chance to speak if you want, and also you too, Darius.
Well, Vanessa, you did very well. You pretty much covered the whole subject, but I appreciate you. Full of knowledge. That's what we are lacking in our community. I moved down to Florida about 5 years ago, and the disparity was even greater than what I thought. coming from Columbus, Ohio, which is, but the resources for preventative care and child care, all these other resources that were available. And then I come here to Florida, and I just was so disappointed to find out that there's not a lot of resources available. Some of the disproportionate things, I come from a very small town in Youngstown, Ohio, and some of the things that are very disturbing is lack of food. There's some areas in the country where there's no grocery stores. So some of these things do play a big part in nutrition, which also can cause a lot of our ailments. Just the fact that in our culture, we all eat different. And as you all know, a lot of Black Americans, we tend to eat a lot of high fat diets. And that's because that's what we were taught.
Yes.
And as one of the things as a provider that I try to do is always try to do education, just like Selena talked about learning your own body. You have to be responsible for your own body, the way you eat, exercise. And as we know, there's a lot of disparities in access to a lot of primary cares in Florida, a lot of primary care physicians. And so that's one of the other things that I've seen, some of the areas where there's lack of medical and professional providers to care for patients here as well. So there's a lot of different areas that I feel, but Vanessa, like I said, you did very well. You hit on a lot of them. So I thank you for that. Thank you for your time.
Thank you.
Absolutely. Thank you, Cynthia. Darius, I want you to hear how you feel, because you're actually at the health department. You see the numbers, you see them as they come in year after year. What are your thoughts on us being disproportionately affected by different health disparities?
First, let me say good evening to everyone. I apologize for being late. I was caught up with my father, trying to be a good son and making sure he was situated. I don't think there's any one answer to that particular question. I think some of it has already been touched on. There's a lack of, I think, knowledge. There's a lack of resources. Historically, the Black community and other communities of color have been set up for failure.
Yes.
By the system.
Mm-hmm.
And because as a collective, we don't control the resources, we're constantly being in the position of being basically whatever is left over, whatever is thrown at us, we've had to make something out of nothing. That's why we started eating the hog. That's why we started eating chitterlings and hog maw and all, some of that other stuff that that some of us like to eat, because they gave us the worst part of the pig and we made something out of it. We made it taste good. So I don't think there's any one answer. I think a lot of it is rooted in history, and a lot of it crosses different factors such as socioeconomics, literacy. I mean, we can keep going across the board.
Mm-hmm.
Well, now that we have moved past a lot of the things that we've gone through in the past, and we have more insight, how do we get our community to be excited about taking better care of ourselves and to take advantage of the healthcare providers that we do have in our communities? And let me go a little further. So here's the thing: we also do a lot of outreach here with Metro Inclusive Health. We spend a lot of time trying to reach different communities, but most times, as we said before, sometimes clients just are not willing to come. How do we get our communities to be excited about their healthcare, to use the insight that we now have to just kind of seek just better healthcare regimens for ourselves?
Was that question directed at anyone in particular? Okay. I think it's very important that we have to become a stable presence in the communities that we serve, not just when we're doing an outreach event, not just when we're doing a testing event, because that is when people, just being honest, that's the only time some people may see
Right.
some
Mhm.
organizations or some groups. And so I think there's got to be some effort to establish trust in a
Mhm.
dialogue in the communities that we want to serve, outside of us just being there to get testing numbers. And I think that will go a long way to build community trust. If they see you more than you just wanting to ask me to take an HIV test.
Right.
But if you, and not just see me, but you make efforts to show that you are an active part of this community.
Absolutely.
Right.
Right.
You know, Darius, I think that's great too, because I think whenever I'm out, I take it very serious to learn community members by name. And so that when I'm talking to them, I can address them by their names and not just, hey, how are you? You want to test? It's, hey, Pam, how you doing, Miss Pam? I saw you yesterday outside. You know, you have to be able to meet that community where they are. I want to ask all of you, what demographics do you see coming through your doors? What is like the most common demographics that you're able to service?
At Reach Up, we're a community nonprofit. Myself and two other ladies, Lo Berry and Dr. Deborah Austin. We were, I say, incubated at the University of South Florida for 10 years. And then during that 10-year time frame, we recognized that we could not fulfill our mission and continue to stay at the university. So we decided that we would do our own 501c3. And we went from one major federal program to 12 different programs. We were writing like crazy. And I believe in divine intervention. And as God would have it, we got everything that we wrote for. And one of the things we had promised the community when we first were even at the university was that we would not be one of those grant funded programs that come in, when the grant is over, 5 years, and then you wash your hand, grant is over, all the resources is out. So what we did was stack the grants, in that when one grant ended May 31st, we had something else that was going to come in and continue to service on June 1st. And we've been doing that for the last 20 years. So we started working with the racial disparities in the East Tampa area, 33602, 35, and 10. And then a portion of, we also included 33607 in that, because they were revitalizing the West Tampa area, and then there weren't any services in that area. So our primary focus was on the racial disparity between Blacks, because at that time, Black moms were dying at a rate, in particular areas in East Tampa, a rate of 4.5 times greater than our white moms. But then with the research, because we had a heavy research arm written into the grants and the affiliation with USF and FAM and some of the other historically Black schools, we also found that the longer people stayed in this country, even the Africans from Africa or people who came from Mexico, the longer they stayed in this country, the worse their outcomes became. So we're still seeing the majority of Blacks and then some Hispanics, and periodically we would get people from Bosnia, or people who spoke languages that we had to try to chase down an interpreter so that we can perform the services or get them connected with resources in a language that they understood. So our demographic has not really changed much. Still primarily Blacks, Hispanics, whites, and others.
Thank you so much. Cynthia, 1 second. Thank you, Dr. Taylor, for joining us. We really do appreciate you being here. We're just asking what demographics are walking through your doors, and why do you think that is? So Cynthia, you can go ahead and answer if you like.
Dr. Taylor can go because he just got here, so he can answer it. He can answer first, and then I'll go.
How you doing?
Good afternoon.
I'm Dr. Taylor, born and raised in Tuskegee, Alabama. Atlanta sister was my first girlfriend, but that's years ago. I was in the military. MacDill Air Force Base is here. There are very few Black dermatologists in this state. Maybe there's 1.5, maybe 2.5. There's just not that many. And so the experience I've had over the last year, just say in a year, a lot of my fellow dermatologists are asking me, why are you doing so well, Thomas? Why are you doing so well? And the answer is, as long as there are Black people in this city and when the military people come, I'm going to do well. Mm-hmm. And they were trying to put that together, how I'm doing to what patients are still coming. And so I'm very appreciative about that. As far as, I'm not sure if you want to know the disease processes that I see that are very unique to us as people of color. Number one is hair loss in women. That's very big. My mother and all her sisters and her mother would bury wigs on their head. And that kind of goes back to how women of color start taking care of their hair as infants. And then it works all the way up. And I have as a big proportion of my practice is saving women of color's hair. Mm-hmm. And as far as, you think about it, when I was in medical school, it'd be a 2-volume medical book. And it got to the chapter on skin of color. Guess where it was? It was the last chapter in the book. And you think I'm joking. Now, this is a 2-volume book. Now, the majority of the people in this world are people of color. Mm-hmm. One way, whether you light, whether you people of color. But the last chapter on that is people of color. But it's changing. There's some dermatological sisters that, they went to, say, Howard, predominantly Black schools doing their residency. And they're changing that as far as the literature and articles they write in the top dermatological magazines about skin of color. Well, how do you treat it? What do you do? How do you treat keloids? How do you treat, acne keloidal Dallas nuclei, which bumps on the back of brothers' heads? How do you treat that? Brothers or sisters that have draining abscesses coming out their scalp? What do you do? Mm-hmm. Things that are very unique to people of color. Even things that both races get, the hit adenitis suppurativa, but in brothers and sisters, the keloids, and so you get a very difficult problem, or simple acne, and people of color, with the dark marks. The acne may be gone, but now you have these dark marks that have to be managed, and so those are things that are unique and they have to be discussed. And so, but they took that chapter, skin of color, out of the textbook. It's not there anymore. But guess what? The picture's not there anywhere. So, and that's why these sisters from Howard, they're doing a good job making it a front burner. How do you treat skin of color?
Thank you so much.
All right.
Thank you.
So most of the population that I see at Metro, I wish we see more Afro-Americans and Blacks, because there tend to be a phobia when it comes to the gay population, as we know. It's funny how now that we're seeing primary care at Metro, when Blacks come in and they see me, the first thing they say is, I didn't know you guys had a Black nurse practitioner here. I didn't know you guys had Black employees here. So one of the things, just like Vanessa and Darius said before, putting our faces out there, going to the community, being an advocate for our people to let them know. I've now started to see more Afro-American females to discuss PrEP, which is a preventative for HIV medication, which now we know, as Darius will tell you, Florida is, I think we're number 3, I don't know, for HIV for heterosexual Black females.
I believe we're like number 2 or number 3.
Oh,
Yeah.
okay. Well, see, that means that we got to do better. And so I just wish that we did see more Afro-Americans. I wish one of my goals, I wish we could go to some of the Black churches to let them know that in our area, that let them know that we are there and we're there to educate them, as well as, you know, teach them about the things that they are afraid to come in and ask. One of the things that a lot of Black women, there's a lot of Black gay males in our society that sleep with women and men, and yet Black women are still not using protection, condoms. They're not educated. It's just one of those things that I wish that we would put more effort into, as far as, like you said, Vanessa, literature, programs, you know, different gatherings, so that we can educate our people.
Darius.
Yes, sir.
Hey, I have a question for you. What I've noticed, this is just me, you know, I've been in medicine a long time, but like when I go to these meetings, one is we have a physicians of color meetings like every quarter. The number of black men, physicians, is decreasing. And most of the majority of people, you know, of young Black physicians, they're either females, and if they are males, they're not from here, they're from the islands. Have you noticed that?
Yes. And, you know, because I work in the world of HIV and AIDS, and that's what I do. And there are not a lot of, that's why I'm so happy. I've never met Miss Cynthia. How do I say your last name?
It's Sleppy.
Sleepy.
Yeah. I was like,
Not today.
it's better to ask permission than forgiveness.
Yeah.
I spoke with you a lot of times, Darius, so I thought you would remember who I was.
I was looking at your face like, I think I know her. Yes, but you know, it's been a long day. But yes, I have noticed that, and I think that's one of the issues too as well, because there's such distrust, particularly in the African American community, surrounding healthcare. It's sad that many of our brothers and sisters actually do not expect to have a positive experience when they walk into a healthcare setting where, you know, and what is so imperative is that the experience starts from the moment the person walks in the door.
That's right.
Correct.
And I think there are some people that work in healthcare and in public health settings that don't necessarily have that understanding.
That's right.
And if a person has a bad experience at the front desk, that has set, for example, that has set the trend for how the rest of that visit is going to go.
That's right.
Whether or not that person is going to be receptive to what the physician is saying, whether or not that person is even going to come back or not. I've seen that a lot with our younger, and it's, you know, it's interesting. We were talking about our young Black men, particularly here in Pinellas County. We have a serious problem with, in terms of our new cases of HIV infection, with young Black men, the ages 18 to 29, and then that 30 to 39 age group. And I'm not going to forget our seasoned saints either, because we've seen some increases there too as well.
Right.
But particularly in with our younger people, our young Black men, we are seeing that's where the majority of the new cases in our county came from last year. Young Black men. And many of them, some of them are, you know, men that like men and women. I think that this is a good place to start having some conversations, and I know Metro has already done this, about sexuality in our communities, and really to start to tackle some of the stigma
Yes.
that is out there surrounding sexuality, because that influences so many people's decisions.
One of the things that I was on the board of Black nurse practitioners and doctors at Columbus, Ohio. And now that Dr. Taylor brought it up, this is a good forum for us to possibly talk about establishing some kind of groups where we can come together as Black providers and as well as the industry throughout, you know, somebody in each areas to educate and come on to these different forums to keep the community engaged, just like Dr. Taylor said.
And I also think that we have to educate our young professionals to move forward and get into decision-making positions so that they can make these policy changes, because it's going to be extremely challenging to be working it from just working the clinic or working in even the hospital on the floor. You have to get in a decision-making position. So we need to train up leaders. Dr. Thomas was talking. I say Dr. Thomas using
That's
your
right. Everybody
first
says
name,
that
but
too.
is that okay? Dr. Thomas talked about how the number of Black docs are decreasing, and then they're increasing from that they're coming from other countries.
Right.
I think what we've done in this country is make it so challenging that it's difficult for people to stick to going all the way through school and not graduating with $99 million in student debt. And when people look at that and the cards don't play out for how much they have to pay back in student loans, and then what they're going to be making when they first come out of school, many young people are choosing other careers. But then the push in other countries is to have their young doctors come over here so that they can learn. And then we see our own African Americans, the pool just dwindling away. And I think we have to do those pushes with community folk, community professionals, to push people in that direction, and then give them the names and resources of people that they need to contact, concrete people, not, oh, well, you just need to go online and find out this information.
Thank you.
That's true, but I have a program here in my office, and this is a true reality. I mentor high school kids.
Whoa, excellent.
For medicine and dermatology, and over years. I mean, you know, I'm not sure if I'm older than you guys or younger, but over the years, and I'm sitting here with my new assistant office manager, my daughter, but and I offer free assistance to high schools for kids to come in to see me and then rotate with me. And whoever rotates with me gets either a good job as an RN, physician, PA, or something. And to this day, after all these years, I'm telling you, I've not had one male person come to rotate with me. Not one. And the closest one was a brother from Haiti, but he was older. He had a family, and you know, and he was in college, and he wanted to rotate me. But I've had not one kid from high school come to my office to rotate with me to see me see patients. Not one. After all
Dr. Taylor, so I hear you in your efforts to train our leaders up from younger. Can anyone speak to any protocols or any policy changes that you all have implemented in your agencies? Can you hear me?
Are you talking to me?
Okay. So I'll speak to everyone. Can you speak to any policy changes that you all have implemented in your offices to work with our African American communities a little bit better, or anything of that nature?
I would like to say and I'm only speaking from the realm of my experience and what I do. I think it's so important, and I'm talking about us Black folks, that when it comes to initiatives for the Black community, and I want to go back to Miss Vanessa's point, that it is so important that we have people in leadership that look like the people you're trying to connect with.
Sure.
And the problem is, honestly, in many of our organizations, you don't have people that look like the people you're trying to reach in decision making capacities. Now, you might be in middle management, you might be a team lead, but the problem is when you start looking at the demographics and makeup of organizations, and you don't see somebody. If I don't see anybody that looks like me at the upper level of leadership in those organizations, to me that is problematic. Especially if the organization is trying to make connections or inroads with a particular community. I wanted to go back to that when Dr. Taylor, made the point about the decrease in Black professionals, and you, Ms. Vanessa, with because that is a problem in HIV. One of my mentors just recently published an article when we were talking about ending the HIV epidemic, and really this could apply really across all health disparities. And I'm trying to say this in an appropriate way.
So say it the right way.
Yes.
Say it how you feel it.
I need some of these people that's been sitting in position for 40, 50, 60 years, making decisions, but have no direct connection to the communities that they're trying to serve, to move out of the way and to bring in people, one, that look like the communities they're trying to reach, that have new ideas and fresh perspectives. Because that is the problem in some respects. You have people that have been at the top for so long, and they may have a lot of institutional knowledge, but they're not in touch. They're not in touch with what goes on the ground level. They're not in.
But those people have to come from younger, the people behind this, the younger generations. They're going to have to come. They're going to have to push that mood, that attitude from the younger generation to push it up.
Yes, but I think also there has to be some at the senior level of management. There has to be.
There does have to be guidance. There does have to be guidance.
And I also think that we have not done a very good job at asking the right questions to the right people. For instance, if you're looking at an executive team and it's not a diverse executive team, then we need to not just assume, oh, I see how that is, and then move on to something else. You ask the question, there aren't any people of color on your executive team. Help me understand. Yes.
Can we clarify real quickly? Because I just had this discussion with somebody. Because now lately, when I hear communities of color, it tends to not all communities of color. Anybody that's not white is being kind of umbrellaed under communities of color. And I just want to know what your personal interpretation of communities of color is. Because when I hear communities of colors, I'm not thinking about any other community. For me, when I hear community of colors, I think Black folks.
Yeah.
Well, my primary is Black folk, and then Hispanics. I will say personally, I have to advocate for Black folk. That's who I am.
Mm-hmm.
And that's who I've always been identified as. Angela Davis was my idol. I had the biggest afro that you wouldn't believe. You wouldn't know it now.
Mine was bigger, Vanessa.
But I advocate for my own, because we are the ones who have been left behind for so many years. And I truly believe that in order for us to turn things around, and we're always so forgiving of everybody else, and there's nothing wrong with forgiveness. And when I see a patient, like I said, I've been a nurse for over 40 years. When I see and take care of a patient, I'm going to take care of the patient because that's what I see. I don't care whether they black, white, green, or blue. I'm taking care of that patient because they need to be taken care of. But when I talk about people of color, meaning Black people being in an organization, in the executive teams, the board of directors, all of these different things, there's a process. And what we as Black people have not, and this is Vanessa's personal opinion, what we have not been good at is asking the questions. Why is it like this? To bring it to people's forefront, well, maybe we ought to consider this, because I think that because there's been so much privilege, it's not even a thought. Like, they don't think about it. But then we have to bring it to the forefront. When we talk about mentoring people, when I started with the program that we at USF, our executive team was multicultural, but it was the three co-founders that moved out and became Reach Up Incorporated. Now we work with everybody. Lo, who we chose to be our president and CEO, said we work with everybody, and it's true. Because if we can work together to propel ourselves forward, then that's exactly what we have to do. So then when we had an opportunity to have registered nurses, student nurses come, we've always been a clinical rotation site for community health nursing. Now, the only way we got that through USF is because when I came to the program, I said, we need to be rotating nurses through here. We need to be a community rotation site. So then we got the award from USF, the Clinical Rotation Site of Excellence for USF nursing students. Now, many of the people, because I push getting in positions, decision-making positions, I've had nurses who have come with me and started in our organization as nurse case managers, and then have moved to perinatal nurse managers, director of programs, all of those things. But it's like Dr. Thomas says, you got to keep mentoring, and you have to keep pushing the people and helping them to understand that it's bigger than them. Yes, we need jobs because we got to pay our bills and all of that stuff. But this is helping to propel us forward is more than I just need me a job. And helping them to understand that, so that when they get in decision-making positions, then they can pull somebody else to come along behind them. Mm-hmm. And this is the last thing I'm going to say. Dr. Deborah Austin, who is one of the co-founders, she sent me a quote that one of her mentors gave to her, and he's from Ghana, but it went like, it's not the warriors that save a nation, it's the elders, because the elders prevent people from being ignorant. So now I'll be 65 in June. But I know what my mission and my role is. So yes, I have retired, sort of, but I'm still working because there's so much stuff that we have to accomplish. And I need to be able to accomplish that and turn the reins over to somebody younger so that they can continue to work.
Absolutely. Dr. Taylor, I wanted to thank you so much, Vanessa. You always bring up such good points. Thank you for that. Dr. Taylor, I do want to switch gears and kind of ask, with your focus being on skin, what are some things that your focus being on skin?
Okay.
What are some things that our community would need to know that could be like silent killers of our, with our community?
Well, the most important thing that I see again is hair and hyperpigmentation. That means with any injury, any disease process of the skin, any surgical, when we heal, we're going to heal with dark spots. And so I see that every single day when people have hyperpigmentation from whatever, and trying to manage that without leaving big white spots, which is even worse. That's very big. As far as, and then the other one we had talked about before is hair care. How can you continue to have nice, beautiful hair when you're doing things that is so destructive to the process of keeping hair beautiful? The other thing is that like simple diseases, whether it's eczema, whether it's urticaria, whether it's fixed drug rash, sarcoidosis, cutaneous T-cell lymphoma, those things present different when people have pigmentation in their skin and they get problems with hyperpigmentation. Now you got to not only deal with the initial disease process, now you have to deal with a secondary problem, which is the hyperpigmentation. And those are very big cosmetic issues that I see every single day. As far as skin cancer, we're down in the state of Florida. In my lifetime in Florida, since I've been here since the early 1990s, back then, I may have seen 2 or 3 cases of melanoma of people of color, but they were misdiagnosed. One lady came in and she says, Dr. Taylor, my wart on the bottom of my foot is not going away. And I look at it and immediately I said, this is not a wart. She had been going to this guy for years and biopsy, and by the time, it came back malignant melanoma after being there for 10 to 20 years, it had already spread over the entire body. I've saw one on the tongue and on the mucosal surface of the lower eyelid. But you have to look at the things and understand that those can occur in people that have pigmentation in their skin. Even though we as people of color, we're born with FPF factor of 15 and 30 in our skin. In fact, somebody's always asked me, do black people need to wear sunscreen? I said, well, if you're not playing tennis all day or like Tiger Woods out playing golf, when we wake up and walk outside and just going to work, naturally we have FPF of 15 and 30 in our skin naturally. But if you're going to be outside for a long time, you need to put on sunscreen. Because I have a lot of people put on sunscreen and they don't need it and they have skin rashes from the sunscreen. But anyway, but that happens. But those are the things that bother me the most is pigmentation and hair problems.
Thank you so much. I wanted to ask all of you, professionally, how has COVID affected the way that you service your patients and your clients? Do you are you still seeing a decrease in medical appointments? If so, why do you think?
Cynthia?
Oh, sorry.
Go ahead. Yeah, I'll go first. I like to talk. I should have been a preacher.
So basically, just like with all providers, initially everyone was scared of, coming out after the quarantine, but eventually due to telehealth, our numbers increased. Actually, we started seeing more patients coming on telehealth visits than actually, because of financial issues and other disparities, they weren't able to come into the clinic. So the telehealth really helped our population come to some of their appointments. Some patients were calling in for chest pains. I'm like, no, you don't call telehealth. So just educating patients on when to call and when they needed to come in. Eventually now we're back up to our full schedules pretty much, just a little bit off, but telehealth has made a difference in this time during the pandemic.
We Reach Up is primarily a home visiting program, but when we had to shut down for COVID, we immediately switched to getting the pieces in place that were HIPAA compliant so that we'd be able to do the telehealth home visit completes, if you will. And then we saw our performance measurement had always been at a minimum of 2 to 4 home visit completes a day. And when we weren't able to go out and do, we struggled many times to get even 2, an average of 2 a day. But then when COVID happened and we went to the phones and were doing the visit by phone, people were getting 5 and 6 home visit completes a day, and still educating and still doing. We have they're called prenatal and infant pathways, because we are trying to become evidence-based. So developed, and it was Reach Up, the Healthy Start Coalition of Hillsborough County, and other partners developed clinical pathways to be able to take care of our clients in the community. We want to be evidence-based. So we had specific time frames that you're supposed to do things. So we continued to do that even as it was on the phone. And then the coalition gave the okay for what we call a hybrid model. So the people who wanted home visits, and of course, with the adhering to CDC guidelines, those who wanted home visits, we did the home visits. And then those who wanted to do the visits by phone, we did those. But we saw an increase in a significant number of clients, the same as Cynthia, because people didn't have to figure out their transportation. When COVID happened, many of the doctor's offices, like, they would only want the actual patient and then maybe one other person. But a lot of our ladies have 3 kids and the dad or their husband, whoever their significant other was. So they came with a bunch of people. Or if they came on the bus, they don't want to sit and wait outside in the sun until somebody calls them in, because the doctor's offices were doing like 1 or 2 people at the time so that they could manage it.
Thank you. Anybody else?
We don't per se see people for services at the health department, but other than our ADAP drug assistance program. But with the onset of COVID, we have now transitioned everyone to essentially picking up their meds from they can do mail order or going to the retail pharmacy to pick it up. We don't see patients there directly for treatment. We depend on great folks like you all on here, providers on here, to provide those services. And so in our conversations with our partners, we have gleaned that, of course, because of the fear and stigma surrounding COVID, that, nobody knew what it, people didn't, when COVID hit, nobody knew what it was, and people were getting it left and right. And, so I think it's just the fear and anxiety over it was, just really added to why people weren't going to appointments. And even providers, there were fears for providers. I mean, they have to be concerned about themselves as well, and their staff and their safety.
Yeah.
So
Absolutely.
And see, my big thing with me, as I've been trying to discuss with me, is mentoring. And obviously with the COVID virus, I haven't been able to mentor the high school kids. For a whole year, I have not had one. And I used to have 4 or 5 a year. and now I've had 0. And so my ability to reach out and touch someone's life and change it has been reduced to 0. And that matters. There's a motto I have: the chance you miss, the time will not forget.
Yeah.
And I'm not sure it's going to be this year or next year, but there's a group of people who I can't mentor to that's being missed.
Thank you so much.
Okay.
At this point, we're going to just have a quick video in reference to COVID. Thank you so much. I know, Cynthia, you have to leave in a moment, so we do appreciate you being here. And I want to thank you publicly for being a part of this discussion. Thank you so much. Okay, we can do our video. Okay, I've been given a new narrative, a new directive. All right, so we'll ask the last question.
Kyla, excuse me, Kyla, I'm about to leave, but Dr. Taylor, I would appreciate if you would give us your information so that if I have any patients that need to see dermatology, I can send them to you.
Okay, do that now.
Okay, nice to meet you, Vanessa, Darius.
Oh, it was nice meeting you too.
Take care. Talk to you guys soon.
Dr. Taylor, you can leave it in the chat. There's like a private chat that you can put your email address. You can type it for us. The last question that I have for you all is, what would you like to see happen within the Black community to improve Black health? Hey, daughter.
You saw it.
Yes.
That's your unpaid executive assistant.
No, she get paid. Trust me.
I know that's right. Ain't nobody working for free no more. I think conversations like this are a great start. I think more conversations in a more public setting, and I realize that's been difficult because of COVID, but more conversations in public settings, particularly in the areas where we're trying to reach people, some of our most vulnerable folks, would be more impactful. Also, but the power, I love the power of the internet because you can reach people anywhere, and this has been great, and I hope that we see more things like this, and hopefully once we get back to a point where we can start really being in person again, you can expand beyond this and start doing some more in-person things.
Let me ask you, have you guys ever heard of BAMA, Bay Area Medical Association?
I personally have not.
Never heard of Bay Area Medical Association. That's the group of physicians of color that get together on a quarterly basis and meet, and they have people come in. That's interesting. There is a president, and I encourage you, the person that I don't know her name with the black dress on, but to reach out to BAMA, the Bay Area Medical Association.
I sure will. Thank you so much.
Bay Area BAMA, Bay Area Medical Association.
Perfect. Any closing statements, Ms.
Well,
what we could see to improve?
What I'd like to see is more political will to make sustained policy changes and take advantage of our rights as citizens. We have to do better than you come out every 4 years, maybe, to vote for the president. We have to do the local elections and go and visit the legislators, because we're constituents too, and participate in that political process. And I am by no means an expert on that, but I have resources that can help me get where I need to go. Also, strengthening partnerships both locally and nationally. And we desperately need more Black docs, more Black APRNs, RNs to address the physical and mental health. But we also need more Black financial educators and certified financial planners to address financial help, because we keep going around the same poverty circle over and over that poverty mountain, then not really recognizing what being educated on the concepts that wealthy people have been educated on kind of all along. And we just don't get that type of resource. So we need to have more of those and leverage the resources in support of improving health equity and reducing these poor outcomes. And we're not going to be able to do, the 4 or 5 of us that are here can't do it alone, but with people like Paula, Evan, who's willing to be transparent about their lives. And I liked what Evan said about his just ignorance of the healthcare system altogether. He is a prime candidate for helping education into the community, but he can't do it if he's in the office. I'm not sure what his role is for here, because I just saw and met him through this skit business, but he is well able to go out and do that. Is that him laughing in the background?
So shout out to Evan Clark. Evan is one of our PrEP services navigators, and Evan does an amazing job. I oftentimes walk by Evan's desk just to hear him interact with his clients. And you are correct. He is a really good candidate for educating our young people about the services that we do provide and how it can impact their lives. So thank you, Evan, for that. Mm-hmm. He did a great job on the skit. If you missed the skit, you need to rewind the whole
Yeah, it was good. And Miss Paula too. That was, extremely courageous.
Program. Paula's part of our peer program, so that's a huge part of her job in helping our clients to get the help that they need. And if you ever have met Paula in person, the person that you saw on that video is exactly who Paula is. So Paula is very outspoken and always willing to go above and beyond to help anybody. So definitely, absolutely. You think you want to close us out, Dr. Taylor?
Say what now? To close you out? I don't want this to be one of these meetings that is the one and done. We need to continue this discussion. Are you Kyla, Ms. Winfrey? Okay, all right. Go ahead.
So my name is really Kyla Emmons, but it's like the Oprah Winfrey, but Kyla
okay, Winfrey. I got you. All right. But I would like for you to come to our office and we can keep this conversation going, and we can reach out and my daughter is sending you information about our phone number and address, but I would like for you to come out so we can talk to continue this discussion. And I would love for you to get involved with the Bay Area Medical Association. I'm surprised you don't know anything about it. Again, that goes back to that big void. There's a void somewhere. Mm-hmm. And, we have meetings almost on a quarterly basis before the COVID virus, but then you got physicians and from all over Sarasota, Lakeland. We get together and talk, and that you didn't know anything about it concerns me. But so we look forward to seeing you. Okay, and thank you everybody, and it was good seeing everybody. And good night.
Absolutely, thank you so much. We will definitely work hard in getting more research and learning more about what's out there. Thank you. Right. So this is our Black Empowerment virtual event, and this will be happening at least one event each month. So please look out for more information. You'll be able to register as the events come out. But we definitely don't want this to be a one and done either. We are working very hard here at Metro to keep these events going and keep the information to be distributed to our community. So thank you all for being a part of this. We really do appreciate all of you. Thank you so much. And now we will have a video about COVID. Thank you.
Certainly. Bye-bye.
Bye-bye.
Are you going to play the video?
Yeah, Miss Vanessa, I can't do every job. I gotta wait for the people. So we're waiting. Thank you so much. I appreciate you all.
Hello, Black America, and people who pay attention to what Black folks are doing. My name is W. Kamau Bell. there's good news out there. There's a COVID-19 vaccine. Yay! But the bad news is, as Black folks, it's hard to trust what's going on. So what do? Well, we turn to people we can trust. Black folks. But not just your uncle at the cookout. No. Actually, not him at all. I'm talking about Black scientists, Black doctors, and Black nurses. Okay, first question. The vaccine happened fast, like super fast, like Usain Bolt headed to the bathroom fast. Is that something we should be concerned about?
Having an emergency authorization for these medications was critical, but that doesn't mean any steps were cut.
Anything where money could be traded off for time, that was happening. Like money was no object.
They still have all of the rigor that they use for approving any vaccine. So we can feel confident that the science is still there.
The messenger RNA technology has been in development for the last 12 years. So even though you hear this thing about warp speed, believe me, that was not warp speed.
And I think the data is real. It suggests it's highly effective.
About a week or so after your second dose, the people who had gotten the placebo or who didn't get the true vaccine, their rates of coronavirus continued to climb. Whereas the people who had gotten the vaccine, it just flattened out.
And what about side effects?
Soreness from the injection site.
I had a little bit of arm soreness.
Arm sore? Is that a side effect? My arm's sore right now.
The common things, soreness at the injection site, headache, fever, maybe a swollen lymph nodes.
The second dose is when there's more common, those systemic side effects.
Is this like one of those pharmaceutical commercials where at the end they talk real fast about the side effects and it's like, you're also going to get hair from your eyeballs and vampirism?
My sister texted me the second day after I got the first vaccine. And I remember she was like, "Are you a zombie yet?" And we just laughed like, "No, I'm not."
So the big answer is no. And the reason being is we are not injecting the virus into your body. The vaccine is training your body.
It is making those antibodies to fight that disease. So I view it as a positive thing.
So here's a question from everybody's uncle. And since I'm an uncle, it's a question from me too. Are the drug companies just trying to get rich off this?
The drug companies will certainly get rich.
Oh, drug companies are always trying to get rich, but that's not the point, right?
That is really how a lot of our innovation happens. That is why the drug companies will spend millions upon millions in research.
Were Black and brown people a part of this process, or was it only like white folks, like NASCAR white folks?
The trials were intentionally broad and inclusive.
Yeah, Black and brown folks have been recruited for the clinical trials.
We have ensured that each of the 4 historically Black medical schools, that we are all vaccine trial sites.
Here's the big question. How much are you charging us for this vaccine?
Right now, getting vaccinated is free.
Free?
Yes, it's free.
Like free.
It will be free.
Like not even free 99.
We have not charged anyone.
Okay, should I be suspicious that you aren't charging us?
No, because there are some things that the government invests in that for the good of the people.
Taxpayers like you and I contributed to the development of these vaccines.
What if I'm not worried about getting COVID-19?
Like you could say, I never had smallpox. I've never had tetanus. Why do I need the shot? That's why we give vaccines. Vaccines are prevention.
I pretty much tell people you're going to be exposed some kind of way, right? So you better be ready to fight.
And what about you? Will you?
I got my first dose about 3 weeks ago.
I have not gotten the vaccine yet, but rest assured, I'm anxiously waiting.
I definitely will be getting vaccinated when my turn comes.
I was scared getting it. And then after I got it, I was like, oh, well, I guess it wasn't that bad.
When the vaccine went in, I felt this intense amount of honor.
Like a lot of people, I like to get my medical information from bizarre, dark corners of the internet that haven't been vetted. Is that a good idea?
Oh, dear.
Please do not continue to do that.
That is definitely not a good idea.
Unfortunately, on the internet, pretty much anyone can post anything.
There are no microchips. There's no stealing of your DNA. No, none of that is happening.
Thank you, doctors. All right, I'll let you get back to work. And thank you for allowing me to ask you these questions. But before you go, just want to let you know, your parents are super proud of you. It's all they can talk about.
Wow, such a great video. Really. And Miss Vanessa, I love that you stayed on and you watched the entire video. What were your thoughts?
I liked the video. And I especially liked it because it was Black doctors saying what was true. And we have to do a lot of work to allay some of those fears that our Black people still have about getting the vaccine. And yes, I am going to plug this shamelessly, because I'm at the age now where I can say what I want and I have a platform. So Reach Up is the primary community partner for We Care, which is a cross collaboration of multiple stakeholders who serve as and this is the acronym, work group enhancing community advocacy and research engagement. It was founded by Dr. Kevin Sneed, who is the Senior Associate Vice President of USF Health, Dean, and also the Taneha College of Pharmacy at USF. And the We Care team works to improve the health outcomes among minority enrollment and participation in research, because a lot of the research that's being done is not being done on people like us. In this instance, they have had Blacks to participate in some of the research, but it's almost like pulling teeth. And the We Care team also is working to build trust and mutual respect between the community and researchers. And they've done about 40 or 50 community events educating people about COVID and about the research aspect of it. So I like the video very much.
Thank you so much. And I will go ahead and add, I have been vaccinated myself. I got my second shot today, so I am still here. I'm still able to host the Kyla Winfrey show and be a part of this event. So the side effects can't be that bad. So I want to thank you all for joining and watching. We do have some more. We have one more skit that we would want to take us out. So thank you so much for your time, and thank you for joining us, Ms. Vanessa. We do appreciate it.
Thank you for having me.
Thank you.
Man, Evan, Selena, all this tonight, my heart is overjoyed. It's been so much information. I just don't know what to do with it. It's, we started out with Evan, you telling us about, Henrietta Lacks and the Tuskegee experiment, which is, horrible things. But, if we don't know where we came from, how are you going to know where we're going to go?
Exactly.
So I thank you for sharing. I took a lot of notes on that, by the way.
Yeah,
Sorry. Exactly. And then Selena, even though I know Serena, still had her trouble delivering her baby, thankfully she and her baby are healthy today.
So true.
It's unfortunate that Dr. Susan Moore, didn't make it, but we learn from her story, we learn from mistakes, and hopefully the doctors that took care of her are doing a better practice now, and they're being held accountable for what didn't happen for her. So I just can't say thank you enough in regards to what you guys provided information on. And then we had that panel.
Yeah.
Can we give a round of applause for that panel of guests? They shared so much information regarding, what clientele they're seeing in their offices, what barriers they're feeling as preventing Black clients from coming into their offices, what they can do. We heard Dr. Taylor, he's offering a mentorship program. I'm definitely going to go home and tell my family about that, because that's something that most people don't even know about, And then Ms. Vanessa, she shared so much information in regards to some of the barriers, what she's seeing, what Reach Up is doing, how she's been a nurse and advocating in this community for over 30 years. I just can't believe it. And you can't, with Darius, always being the public health, you got to have the public health guy in the field. Got to. He's the one providing all the stats, So we didn't have somebody like him to be able to tell us where to go. How will we know what to do? And then our very own Cynthia Sleppy here at Metro. Thank goodness we have a Black provider here. So a lot of people come here, like she said, because of her. If they didn't see somebody that looked like her, then they probably wouldn't. They may have turned around and not come back in. So I thank Metro for even hiring somebody and giving her a chance to be able to service our community.
Right.
But since I'm talking about Metro, let's talk about some of the things we're doing right here, right now.
Talk about it.
So I think we started offering the COVID vaccine about 2-3 weeks ago,
About that time.
and we're still doing it week by week. We're not only offering it to staff. Staff can get the COVID vaccine for free here at Metro.
Yes.
For free.
That's
Okay.
awesome.
No inconvenience whatsoever. Outside of staff, then you got the community. Anybody who fits the bill in regards to their age or their health criteria, they can come in and make an appointment, and we can get them in and out with about 15, 20 minutes.
All right, Metro.
Okay, and we're doing that about 2 days a week or 2 or 3 days a week. You know, as long as people keep coming, we're gonna keep serving them.
Exactly.
Hats off to Metro.
That's all. That's good.
And then, did y'all even know outside of the COVID vaccine, what's coming down the pipeline? Have y'all heard about the mobile prep unit that we're about to have?
Oh, tell me more about that.
Yes, the mobile prep unit. We're about to engage in something huge. We're going to be taking our health on the road. Okay. So as it was mentioned before, and Evan, I know you are a prep navigator, so I already know you're going to be all over this.
Absolutely.
But I believe some of our providers are going to be out in the mobile unit coming in the near future, going to more disadvantaged communities, offering prep services. And who knows what that's going to open up as far as down the road. You know, it's not out there yet, but we're definitely on our way to having that mobile prep unit coming down very soon. And then even outside of that, you know, we have so many services to offer at Metro. You know, I talked about a couple of them, but just our regular day-to-day stuff, we have a whole linkage team that can assess your needs, that's going to talk to you about behavioral health, going to talk to you about LGBTQ services, prevention and sexual health, top-board pregnancy, you know, mental health, medical case management. You have a whole team that can address all of those issues and see what's going to be the best fit for you. So why wouldn't somebody want to come here and see what they can get out of it?
All in one.
You know, so I'm hoping that this platform really reach the Black community, and not just the Black community, but all communities, because a lot of people misconfuse in regards to what we're here to offer. Sometimes they think that we're Metropolitan Ministries. Sometimes they think that we're Metro the phone company, but we're Metro Inclusive Health. You know, so therefore we have a lot to offer. And I know I talked about Metro, but it starts from the head. You know, our very own President Joe Biden has put in an executive order to advance racial equity and support for underserved communities.
That's amazing.
He's doing that. If he's doing that, what is that going to mean for our individual communities? It starts from the head and trickles down there.
Yes.
And I want to say, it might have been Vanessa, maybe someone else who mentioned, get involved. Your churches, your local officials. We are the ones putting these people in office. We have to be the ones to be able to say, I don't want you. You're not representing my community. You're not representing me. I want somebody else. So if we don't get our votes in, or we don't go to our churches, because we know, just putting it out there, Black churches, we look at our pastors as the gospel, and whatever the pastor says is what we're going to go by. So it's a perfect avenue to be able to get information into the communities through the Black churches. But not just that, like I said, speak up, talk about the issues that you have a concern about. You have to advocate for yourself. You advocated for yourself. You advocated for yourself, even though you said in regards to what your parents weren't able to tell you when you were young, but you're here now, you know, and thank goodness you are breast cancer free. Had you guys not done that, what would today look like? And like I said, strictly from the panelists, they put it on us. We're the next generation to move it forward. We have to take charge and make sure that everything is done the way we want to see it. We want to see it when we are of age. So that's on us.
Wow.
So I was just really thankful, and I was really happy to see everything that transformed tonight. But you know what? I got one more surprise for you all.
What?
What's that?
What?
I got a guest poet coming in, guys. I got a guest poet.
A poet?
Yes. I got Miss Camille Adrian. She has her master's in public health, otherwise known as the Bougie Buddha. She's the CEO of the creative director of Smudge Life, a full spectrum holistic wellness brand and lifestyle focus on quality education and healing experiences. Camille is a board certified life and holistic wellness coach, Reiki master, and holistic doula. Camille offers a vast spectrum of wellness services and spiritual goods at her wellness studio, Meditative Energy Lounge, located in Tampa, Florida. She is a proud FAMU Rattler, where she obtained a BS in cardiopulmonary science. She additionally attended Grand Canyon University for her master's in public health, and currently she is pursuing her doctorate in mind-body medicine as her true skill set is poetry. Please welcome Camille Adrian.
I love that.
You muted.
Oh.
Camille, you're muted.
So sorry. Hi, can you hear me now? Awesome sauce. Thank you. So again, I am Camille Adrian, AKA the Bougie Buddha, and I have a passion for poetry because I believe that art is a form of healing, and healing is what I do, and healing is a part of what you guys do. So I'm very, very thankful. So I have presented a wonderful poem for you guys. It is entitled Health is Wealth. Fact. Health is a state of being free of illness and disease. Fact. Wealth is the abundance of valuable possessions or plentiful supplies and resources. If we're going to address the nature of Black American health issues, we must acknowledge the perpetual understanding of America and her virtues. Health is wealth. Black health is more than just a subset of numbers that correlate to an ongoing saga of nationally recognized disparity. This is merely an observation, a mathematical calculation that reveals even in the act of life preservation, there is a vast separation. And as the narrative shifts dexterities, on one hand, we've been revered for our physical strength, our ability to be praised for natural skill and resiliency, so much that our very nature of our physical health was an evaluation of our worth, picked out of lineups to survive the harsh conditions of tilling the earth. And Black health became an ROI. Because you can't make no money if all your slaves die, and any wise man of wealth and stature losing a state in this greatest investment of the states is a natural disaster. It was of great interest to keep us in good condition, to nurse the babies and to clean the kitchens, the exponential value of Black men and women. Now, before we continue, we must stay present to understand that this is the nature of any man, and we still take care of what we feel has value. This mental framework is the key to survival, and really, you don't have to believe me. Just for a moment, reflect on how you treat stuff that's free. We have all gotten promo cups, bracelets, and company teas, the first things to go when we're streamlining our needs, and we learn to eat the fruit and throw away the seeds. So on the other hand, as this vast shift in the value of the Black community, once Black Americans became a free commodity, the value in maintaining the health of a free man was obscene. But we're not talking about Black America as a population entity, we're talking about the nature of an investment property. With each hand, Black health was a deal, because in the hands of man, Black wasn't even real. Even by the law, Blacks were considered 3/5 of a person, 3 parts man and 2 parts conversion. An unintentional line of demarcation to the beginning of disparity between this great nation, and as time prevails, the institution was met with concern. As a push for full humanity for Black America was not up for discern. To consider the Black as a whole of 5 parts was to switch the nature of Black health from our hands to our hearts. For the course of this shift, we have made great strides to correct the ripple effects of what seemed like mass genocide. And as a collective, we have created value and worth well above that of gold. We recognize the power of seeing one whole, and birth from this ecstatic realization, we choose to bridge the gap propelled by cooperation. We have made great advances, and in the name of humanity, tirelessly giving way to better access, better resources, and improved Black health statistically. But Black health goes beyond the articles, the research, and the socioeconomic status, beyond education levels, population, and system schematics. It is survival of a people who have faced great divide, from the foods that we eat to the places that we reside. And we have moved into an era of understanding, acceptance, and action. Take note that certain disparity gaps have begun to lose traction. And as we invest in our people, in our community as a whole, without the devastation of discrimination taking a toll, we can see the truth of this matter is a simple switch from hands to heart, and we all become rich. The smile of a healthy child is worth more than gold. And what so gains a man if he loses his soul? And as people, we have taken our health into our own hearts and hands, learning how to heal every piece of 5 parts, subsequent to the notion that we have started to bring to light that we are more than just a body, seeing the mind and the spirit as a part of the plight. We have solicited inclusion as a means of connection and glee, a contributing factor to Black disease. There is true healing in being treated by someone who looks like me. More Black doctors, nurses, and social service providers continue to see change in a number that grows higher, and we won't reach our goal until the gap has truly expired. But if health is wealth, then we are building generational means, better quality of life, and one that is free of disease, where resources are abundant and access is vast. And to quote Dr. King, we are free at last. I want to thank you guys.
Thank you, Camille. That was phenomenal. I know it took a lot of hard work for you to put that poem together. I know I kept bugging you enough. So I appreciate you wholeheartedly for delivering that original piece of poetry to wrap up our Black Health event all together. As you can hear and see, we are all snapping our fingers if you can't see and hear us. But I truly appreciate it.
Thank you so very much for having me. This has been a complete honor, listening to the panel today, being present, hearing the information and the perspective. I'm really grateful that this was a program that was available. And like I said, I thoroughly appreciate you guys allowing me to share my creative perspective on such an important event. Thank you so much, Tiffany.
Thank you. You're welcome. All right. So as my co-host Kyla Winfrey, she had to step away, but she did give a pretty good summary of wrapping everything up. But at this time, I just want to say thank you to my entire team and to Metro for giving us the platform to even have this event. As Kyla mentioned, we're going to be having a Black Health event, a Black and Empowered event every month. So we're looking for even more topics to talk about. We have one coming up next month. It's going to be on Black mental health, coming up at the end of the month. I think it's going to be on the 28th. Stay tuned for that. But at this time, I just want to acknowledge the team that I have to work in this event. As we talked about earlier, Evan Clark. Evan Clark is our PrEP navigator. He works in the Tampa location, and he works amongst a team who services all the clients who are interested in PrEP. If you don't know what PrEP is going to allow you to not contract the HIV disease. So it's a huge initiative that we're to keep trying to push so that no more people have to be infected with HIV. Thank you so much, Evan. Now I want to introduce Selena King. Selena King works as a prevention and sexual health educator. She also works with our TOPPER program for pregnant women in both the Tampa and the St. Pete offices. She does a tremendous job in regards to making sure that all of her clients are reached out to and has education on how to prevent HIV, how to have a healthy pregnancy, and also just having a wraparound service. So she's led by a great team of managers. And like I said, she had an instrumental part, not only from what she was able to research, but her personal story of being breast cancer free. Thank you, Selena. I also want to make mention of Topher. Topher, come on here. Topher leads our LGBTQ programming. He didn't know, but he was put on the spot and he stepped in no matter what. So I appreciate all the little ins and outs and the signs being held up. Topher held it down. So I thank you so much for just stepping in with no reservation and coming out to help me out.
Thank you very much.
Thank you. Last but not least, I want to introduce Nate. Nate, come from behind the camera, please. Nate is our the Division Director of Community Initiatives. So Nate does everything, in other words. So anything, a community-wide event for the agency in and of itself, Nate is your go-to guy. Some of you may already know about him and his services, but he is representing Metro, not only from St. Pete, not only from Tampa, not only from Newport Richey, not only from Clearwater, but for all locations. So if you ever have an event that you want to reach out to between the Prevention and Sexual Health Department and Nate, those are your go-to people. And thank you, Nate. Last but not least, as I mentioned, like I said, Kyla had to step out, but Kyla does oversee the Trans Services Division. She's the new Trans Services Coordinator. She's overseeing both the Tampa and the St. Pete locations. I know she did a phenomenal job hosting this event. I'm Tiffany Gray. I was behind the scenes. I may have put everything together, but I couldn't have done it without my team. I'm the linkage program manager over all the locations, but between Nate, Topher, Kyla, Selena, Evan, and the entire Black and Empowered committee, I couldn't have done it without them. So even though I may have been on everybody's nerves, that's okay because it all came together right. So thank you again for tuning in, and please stay tuned for the next event coming up next month.